Have you ever wondered how COVID-19 has impacted the rural institutions in the far-flung areas of India? This pandemic has sent shockwaves across the globe, touching every facet of human life. Amidst the chaos, nations worldwide have been grappling tirelessly to contain the virus and seek out a cure. India, like others, took immediate and drastic measures, implementing a nationwide lockdown from March 24, 2020. This step, although crucial for the virus's spread, carried with it significant economic and social consequences. The most immediate impact was felt by the force, particularly the informal sector, which comprises approximately 90% of the total. These workers, many of whom are economically vulnerable and dependent on daily wages, faced an uncertain future with the enforcement of the lockdown. The predicament was even grimmer for the migrant workers who had travelled across the country seeking economic betterment. Let us now delve deeper into the response of rural institutions in the face of this unprecedented crisis. This video is based on the paper by Naveen Kumar from Delhi School of Economics. The weight of the pandemic was heavily felt by the labour force, particularly the informal sector. Let's take a moment to dissect this. In India, the labour force is a diverse tapestry of occupations and sectors. The informal sector in particular is teeming with economically vulnerable workers who heavily rely on daily wages. When the nationwide lockdown was enforced, these workers found themselves at the mercy of a situation they had little control over. Without sufficient social security in place, the lockdown was not just a pause, but a potentially devastating blow to their livelihoods. Now picture this. Among these is a significant proportion of migrant workers. These are individuals who have moved from their homes to various parts of India in search of better economic opportunities. When the lockdown came into effect, they were far from home, and the challenges they faced were magnified. To truly grasp the magnitude of this, let's delve into some statistics. Over the years, India has seen a significant increase in migration. The census periods of 1991, 2001 and 2011 reported an estimated 232 million, 314 million and 454 million migrant workers respectively. This accounts for approximately 30% of the Indian population. Based on the past trend, this number is expected to be higher. Imagine these people left in a lurch from day one of the lockdown, and it doesn't stop there. Marginalized workers, including farmers and other informal sector workers, have also been severely affected. It is in this dire situation that the role of institutions and governments was put to the test. As we navigate through the pandemic, the health, economic and social crises have been wreaking havoc. But there's another crisis at hand, the infodemic. This is the spread of false and/or misleading information, further exacerbating the current situation and undermining social structures. The virus has not only brought a health crisis, but also an unfortunate social stigma. This has resulted in promoting segregation in our society, akin to caste and class divisions. These divisions may persist even in the post-pandemic era, causing a lasting social divide. The pandemic, in many ways, has become a catalyst for highlighting and deepening existing societal biases. The free and unregulated flow of information can be as harmful as unregulated physical contact. In a society where caste and class segregation tightly regulate physical contact, the pandemic not only deepens this segregation, but also multiplies the effects of bias. Mental blocks, prejudice and social indifference, sanctioned by caste, creed and class, can multiply with suitable stimuli. We're not just fighting a virus, we're battling the societal divisions it's exposing and exacerbating. In this scene, we will explore how the pandemic has impacted social norms, caused a divide, and the role misinformation plays in this scenario. We'll also delve into how this divide may persist post-pandemic and how it's affecting different sections of the society, with a focus on the migrant workers and the inhabitants of Ahwar Kudia. In the heart of Bihar, we turn our attention to a village named Ahwar Kudia. Nestled in the Paschim Champaran district, Ahwar Kudia is a rural gem that balances itself between the bustling towns of Majhaulia and Jagdishpur. The village is part of the Majaulia block and is cradled in the catchment of the Darnauti River, a feature that creates a conducive environment for fish farming. Ahwar Kudia is a tapestry woven with the threads of agriculture. The majority of its inhabitants, hard-working and diligent, find their livelihood in the embrace of the earth, sowing, tending and harvesting crops, with maize being a significant produce. The rhythm of life here is entwined with the cycles of nature, with the villagers' fortunes rising and falling with the seasons. Yet, the distribution of land in Ahwar Kudia is a tale of disparity. One family holds sway over roughly 250 acres, while another presides over about 75 acres. Numerous households, in contrast, possess only residential land. Half an acre or less of land is all that most households can claim as their own, and large swathes of this precious resource are leased for maize cultivation, underscoring the economic challenges faced by the villagers. The inhabitants of Ahwar Kudia are a resilient lot, accustomed to the idiosyncrasies of rural life. But the onset of the COVID-19 pandemic presented them with an unprecedented challenge, one that threatened not just their health, but also their livelihoods. With this backdrop, let's explore how this village responded to the COVID-19 pandemic. As we delve further into the impact of the pandemic in Ahwar Kudia, we need to understand the profound effects of the lockdown and the resulting reverse migration. The sudden enforcement of lockdown, while necessary, led to confusion and despair among the villagers. The lack of work in nearby urban areas triggered a massive reverse migration, with many villagers returning home. In a society where access to information can significantly influence an individual's response to crises, the pandemic starkly highlighted this divide. Information about the virus, its transmission and preventive measures trickled down slowly, creating a knowledge gap that was hard to bridge. The pandemic also laid bare the widening economic disparity. The experiences of individuals varied drastically, with the rich able to cushion the blow of the pandemic, while the poor were left grappling with its harsh realities. Personal stories, like that of a migrant worker who returned home jobless, or a local farmer who struggled to sell his produce, paint a vivid picture of the struggle. The rural credit market, too, felt the tremors of the pandemic. With reduced income and mounting expenses, the villagers leaned heavily on local moneylenders, further deepening the economic divide. The villagers' expectations from the government were high. They looked towards government schemes and the Targeted Public Delivery System, TPDS, for relief. However, the effectiveness of these measures varied, with some villagers benefiting while others slipped through the cracks. The pandemic's impact on children, especially those from marginalized sections, was profound. With schools shut and remote learning a distant dream, the educational disparity widened. The COVID lockdown has exposed the hollowness of the claim that this crisis will help people adapt to technology. It has also aggravated the existing difference in educational outcome between marginalized and privileged sections. As we move forward, it's crucial to learn from these experiences to build a more inclusive and resilient society. In Ahwar Kudia, healthcare services came under immense strain during the lockdown. Located 8 kilometers away from the primary healthcare center, the village does not have any sub-health centers. With a population of 3,000, the villagers are dependent on local unauthorized medical practitioners, known colloquially as Bengali doctors. Among the 22 tollers, only 15 ASHA workers are employed, leaving a significant gap in healthcare provision. Our discussions with these ASHA workers, civikas and local medical practitioners revealed the harsh realities of healthcare during the lockdown. The sudden influx of villagers returning home due to reverse migration increased the potential spread of the coronavirus, further burdening the already strained healthcare infrastructure. Notably, the lockdown led to the shutting down of all but essential services. This resulted in many doctors and healthcare workers being unwilling or unable to return to their posts at hospitals and healthcare centers. This inefficiency in the rural public health infrastructure has made Bihar heavily reliant on private healthcare centers and private practitioners, most of whom lack the necessary competence. As we move forward, it's important to address these gaps in healthcare provision to ensure that rural communities like Ahwar Kudia are equipped to handle such crises in the future. Faced with the pandemic, rural institutions in Ahwar Kudia sprung into action. The enormity of the challenge was immense, but the spirit of these institutions was undeterred. Let's take a moment to understand how these pillars of the community responded to this global crisis. The social institutions, which form the bedrock of rural communities, played a pivotal role. They rallied their resources, focusing on spreading awareness about the virus and the importance of social distancing. But they didn't stop there. They also put efforts into implementing systems for food distribution, ensuring that no one went hungry during the lockdown. The economic institutions, on the other hand, had a different set of challenges. They had to ensure the continuity of livelihoods in a time of standstill. With agriculture being the primary occupation, these institutions were tasked with the difficult job of navigating the pandemic's impact on the farming season. They worked tirelessly to ensure that the produce was harvested and reached the markets. They also focused on creating alternative income sources for those whose livelihoods were disrupted. Now moving on to the local administrative institutions. These were the bodies on the front lines, responsible for implementing the lockdown measures, coordinating health services, and managing the daily affairs of the village. They worked round the clock, enforcing guidelines, coordinating testing and vaccination drives, and ensuring the overall well-being of the community. It's important to note, however, that these responses were not without challenges. There were resource constraints, logistical issues, and the ever-present threat of the virus. But these institutions, rooted in the community, driven by a sense of duty and resilience, navigated these hurdles with determination and ingenuity. The response of these institutions was a testament to their resilience and resourcefulness. They stood as pillars of strength and unity, reminding us that even in times of unprecedented crisis, communities can rally together and overcome. The impact of COVID-19 on rural institutions in Bihar is a multifaceted issue. We've explored its various dimensions, from the immediate and far-reaching consequences of a nationwide lockdown on the labor force to the specific challenges faced in the village of Ahwar Kudia. Let's draw together the threads of our discussion. We began with the stark reality of the pandemic's impact on the labor force, 90% of which is associated with the informal sector. These are the economically vulnerable workers who heavily rely on daily wages, and the lockdown hit them the hardest. Migrant workers, who make up a significant portion of this demographic, found themselves in particularly dire straits. We then zeroed in on Ahwar Kudia, a village in Bihar, to understand the ground realities. Here we saw how the skewed land distribution and the reliance on agriculture made the effects of the pandemic even more pronounced. The lockdown left many small and marginal farmers in a precarious situation, with no means to earn their livelihood. Yet amidst these challenging circumstances, the resilience and resourcefulness of rural institutions shone through. They stepped in to mitigate the effects of the pandemic, regulating the economy, financing health facilities, and providing testing and vaccination. Their role in controlling the spread of the virus while supporting their communities cannot be overstated. The experiences of Ahwar Kudia are a microcosm of the larger narrative of rural India's struggle and resilience during the pandemic. The local institutions, with their deep understanding of their communities and their needs, have proven to be a crucial lifeline for the vulnerable sections of the population during this crisis. As we continue to navigate this global crisis, the experiences of rural institutions in Bihar provide valuable lessons in resilience and resourcefulness. They remind us that in the face of adversity, our collective strength and determination can help us overcome even the most daunting challenges.